Hey guys, Coach Nick bringing you today's Tip Tuesday. This week we have Dr. Jesse Sattler here. He's going to be going over the overhead squat assessment that he does with all of our assessments here and what he looks for.
Okay, so for the overhead squat, our purpose behind that is to look at mobility and stability at different parts of the body while looking at a movement pattern that's very specific to training as well as sport. So what I'm going to have Nick here do is first he's going to set up with one foot at the beginning of our pole here. The other foot's going to go in a position so that he's hip width apart. He's going to bring the dowel up onto his head, going to form a 90-degree angle with both elbows, and then drive the dowel straight up over his head, so that's just behind his ears. Now he's going to go down as low as he can into a squat, hold for a second, and come up. As a clinician, we look at it from all different angles because we're looking at different components, from his ankles, straight up to his shoulders, straight up to his neck, looking at everything, okay? So some of the most common compensations we'll see here are things that some of the athletes could improve upon. First, we're gonna look at knee position. So one of the most common things we see is the athletes may have one or both knees that come in during their squat pattern. A lot of times this is indicative of a potential hip tightness or weakness in some of the musculature around that area. So one great corrective exercise that we use is placing a band just above the knees. This gives the athlete a cue to say, I would like to drive my knees out into this band while I'm performing this exercise. So I can do it with a little bit better form, better hip activation, okay? As you can see, now Nick is able to push out into the band, get into his hips a little bit better. One of the other common compensations that we'll see is that an athlete is not able to get to full depth, or that their trunk may come really far forward when they're doing that squat. So we'll take a look at Nick from the side view here. What you can see here, as he goes down to the squat, his hip isn't really breaking the crease of his knee, all right? So he's having trouble getting down to depth. What you may also see is the trunk coming really far forward because the ankles don't really have any room to go. You may also see the toes point out. So when we see something like this, we have the athlete elevate their heels up onto the board and retry that squat pattern. If it looks much better with their heels up, that tells us all we did was change the position of the ankles. There's probably something from a mobility restriction perspective going on at the ankle, all right? So a great exercise we have athletes work on is going into a kneeling position and practicing getting that joint to move a little bit better by driving their knees over their third toe as far as they can while keeping their heel down. We do about 10 to 15 of these, and then we recheck our squat. A lot of times it gets much better.
So on the performance side of things, Dr. Jesse talked about that those knees caving in, driving out our knees. If you haven't watched our Tip Tuesday on our glute medius exercises, go back and definitely watch that. But another great exercise is our lateral prowler walk here. So how we set this up is we have our athletes lean over, and all we're doing is crossing over like a lateral run, pulling our weight, keeping our core nice and tight as we move forward here. So for our ankle exercises, a great way to strengthen up the front of our shin here, support our ankle, is some of these dorsiflexion raises. So I just have my foot elevated, I have my kettlebell hanging at the end, and we'll go through a couple reps here as we drive up and slowly control the weight down.